Hi, Dr. Sullivan Dermatology. So, as many of you know, there are many different toxins on the market, neurotoxins. So, the first one to come on the market that we know the most, that everybody knows, is Botox. The one that is kind of the second runner-up or most common one is Dysport. And actually, Dysport is kind of overcoming Botox in popularity in the US. I use quite a bit of Dysport. There are other ones like Daxxify. Daxxify came out recently, and the claim to fame is that it was going to last longer than the other toxins. So right now there's Botox, there's Dysport, there's Xeomin, there's Juveau, and then there's a new one called Letybo that is about ready to launch. We're going to be doing it in the next couple weeks in the practice. And so there are lots of options, right? Well, what's the difference between them? Well, they're all a botulism type A toxin. So they all are in the same category of botulism toxin, but the way they're manufactured leads to different results. So some are more pinpoint. So I generally think of Botox and the new one, the Letybo, as being more pinpoint. Dysport has a little more diffusion, and this matters. It depends where you're using it. So in certain locations, we want something that's more pinpoint. In certain locations, we want something that diffuses a little more. Onset of action. Dysport works rapidly, so if you have an event coming up, it works pretty quickly. The new one, the Korean one, Letybo, also works rapidly like Dysport. Botox can take up to 2 weeks to have its complete effect. And then the other thing, I think the thing that patients want to know the most about, and that actually I'm concerned about as well, is duration of effect. So how long did the toxins last? Pretty much all of the toxins that are FDA approved have been studied and have shown to last about 4 months. So I usually tell patients, plan on your toxin lasting about 4 months. Some people last a little more, some people last a little less. If you're very athletic, if you're a man, it tends to be on the less side. If you are a woman, if you don't exercise a ton, it can last you a little bit longer. The other thing is if you are regular about getting your toxin, so if you come every 4 to 6 months, it's going to last longer than if you come every couple of years. So that's a big difference. Right now, I generally tell patients that Dysport, Botox, and the new one, Letybo, are going to last you about 4 months, right? I think Daxxify has the potential to last longer. I've certainly seen it last significantly longer than some of the other toxins. The problem with that I have with it is it's not consistent. I can't tell you 100% that it's going to last longer, and it is more expensive. So I'm always a little reluctant to tell you, to promise you this one's going to last longer when it may not actually last longer. But some patients get a great duration with this. Then the other thing is some patients just, there's something indefinable about toxins for them. I have patients that will only do Daxxify. I have patients that will only do Botox. I have patients that will only do Dysport. They just feel like it's different for them. And the nice thing is in my office, we have all the toxins, so you can really pick the one you want to do. So if you're thinking about toxin, I can tell you it's the most popular procedure in the office. In 20 years, I've almost never had a patient not like their Botox. It's just a very natural, effective treatment. But we have a lot of options for which one you want to do. And I have patients that sometimes, try different ones out. So if you're interested in finding out more about toxins in general, where we can use them, how it will work for you, and which one's right for you, come see me and we'll go over them in person.